Well, welcome everyone again to this webinar about the Pilot and Grant Planning Awards. This award program is supported by the USDeN-Prescribing Research Network. And as way of introduction, I'm Amanda Mixon, and with me is Dr. Sandra Simmons and Joseph Christodoulou. We lead the Pilot and Exploratory Studies Core for the USDeN-Prescribing Research Network. Additionally, we have Dr. Mike Steinman, who is the principal investigator, along with Dr. Cynthia Boyd, who's unable to attend today. They are the leaders of USDeN. So we have no relevant disclosures. We'd like to thank, though, the National Institute on Aging for funding the network, our Scientific Advisory Board, and the people listed here who help make the network run smoothly. So what is the USDeN-Prescribing Research Network, or USDeN? Well, formally, it's the entities you see here on the left-hand side of the screen, led by Dr. Cynthia Boyd and Mike Steinman. But it's also all of you who are part of the community interested in and working in the area of deprescribing. The Pilot and Exploratory Studies Core is just one facet of USDeN, and you can see the other cores and working groups that are also part of the network here. So the network focuses our activities around 5 pillars, which include investigator development, stakeholder engagement, data and resources, working groups, and then lastly, funding for pilot studies and grant planning activities. Today, we're going to focus on this last pillar. So Dr. Simmons and I co-lead the pilot core, and I'd like to note that all this information presented today is also on the USDeN website, which I'll share later. The purpose of the Pilot and Grant Planning Awards are to support early stage research into deprescribing that will likely lead to larger, high impact projects. Funding for pilot projects will be primarily, but not exclusively, awarded to junior investigators, while funding for grant planning projects is usually provided more towards senior researchers. We seek projects that provide key preliminary data, proof of concept, or developmental work that prepares for larger scale studies. There are 2 types of awards that we fund, pilot awards and grant planning awards, and here you can see the full descriptions at this link provided. So I'll discuss the scope of pilot awards now. So we're seeking to fund pilot awards, pilot studies that have a direct and clear relationship to deprescribing that is relevant to the care of older adults and demonstrates a clear path to future grants, research opportunities, and/or career development that's focused on deprescribing. And just so that we're all clear, this is one of the deprescribing definitions that we really like from the University of South Australia, which is deprescribing as the process of withdrawal, dose reduction, or substitution of an inappropriate, meaning high risk, unnecessary, or of low benefit medication supervised by a healthcare professional with the goal of managing polypharmacy, and even relevant for those without polypharmacy, whereby we improve outcomes. And this definition we also have on our website. So for this funding cycle, we'd like to draw your attention to some of our priority areas. We'd like to fund studies that are deprescribing in a variety of care settings, such as home health and hospice. We're interested in point of care tools that help clinicians, patients, and caregivers to stop or reduce medications. And lastly, we want to hear from groups that want to study patient-important outcomes in deprescribing as well. So as a look back, I would like to share the people and awards that we've funded so far. So in the first year of funding, we had 3 pilot awards. The first was about decisions around anticoagulation in patients with atrial fibrillation and dementia by Dr. Greg Ulett. Older adults' attitudes and preferences about how deprescribing recommendations are discussed by Dr. Ariel Green and Nancy Schunburn. And finally, intensification and de-intensification of glucose-lowering therapies among older adults with diabetes and multiple chronic conditions by Dr. Jen Kuntz. In the second year, we had 4 pilot awards. The first was from Dr. Lee, looking at improving medications and deprescribing at transitions for older adults. The second one was from Dr. Joshua Niznik about deprescribing bisphosphonates in nursing home residents with dementia. The third was Dr. Scott Pilla's project about a physician survey around deprescribing diabetes medications. And the last was by Dr. Sarah Vordenberg around factors that predict intent to deprescribing medications. And we also had 2 grant planning awards that year. One was around the group from Team Alice, Dr. Ranjit Singh and Dr. Bob Waller, looking at patient-driven deprescribing. And then from Dr. Sarah Zanton about goal-directed deprescribing in the self-management in community-dwelling older adults with multiple chronic conditions. In the 3rd year, we had 5 pilot awards. The first was by Dr. Wong, looking at deprescribing and telehealth in the setting of home care, developing an intervention. The second was from Dr. Nagam Alabuni, looking at people living with dementia and trying to create a conversation tool called Prime. The third was from Dr. Matthew Dupree, looking at novel methods for estimating deprescribing in observational data. The fourth was the intensity of heart failure pharmacotherapy in older adults by Dr. Kwok. And finally, from Dr. Papaleontu, was deprescribing thyroid hormone in older adults with dementia. And in this last round, fairly recently, these folks started their projects for year 4. We have Dr. Anna Hung, who is looking at the impact of medication therapy management, for potentially inappropriate medications. Dr. Tim Anderson is looking at perspectives of older adults on chronic pain and primary care providers regarding opioid prescribing. Dr. Wade Thompson and Karina Lundby are looking at measuring quality of life in deprescribing trials. Dr. Gina No is looking at understanding attitudes towards non-pharmacological pain management in community-dwelling older adults with multimorbidity. And then finally, Dr. Lauren Hunt is looking at deprescribing of anti-dementia patients who are enrolled in hospice. So in that last round, we had 23 applications and we awarded 5. There was only 1 grant planning project we did not fund, and then there were 22 applications for pilot awards and 5 received funding. So you can see the statistics. These are just a few quotes from prior awardees about how they felt about the program, generally positive, and felt that it helped towards getting them connected with the community, as well as getting their projects up and running and hopefully working towards both publications and future grants. So now I'd like to talk about the eligibility criteria for applicants. So applicants should hold a doctoral degree. They must be employed as a faculty person, a research scientist or equivalent by the start of the award period. They need to be working in a setting such as those listed here, which is registered in the system award management system. And lastly, each applicant can submit 1 application. However, 2 or more individuals from the same institution can apply. Applicants can be from non-US institutions, but you must articulate how the proposed research will apply outside of the home country, including the US. And we encourage applicants from underrepresented groups, including disadvantaged backgrounds and individuals with disabilities. So now I'll talk about the available funds. Each award is up to $60,000 in total costs. That's direct and indirect funds. The indirect costs are charged by the recipient institution's federally negotiated rate. Foreign entities can charge no more than 8% of modified total direct costs. Each award will begin in about August or September of next year, 2023. And the project will last for approximately 1 year. And we plan to fund approximately 3 to 6 awards in the coming year. So what do you need to know about submitting? Well, first I'll talk about the pilot awards. As I mentioned, these are primarily given to young investigators, but not exclusively. And the purpose obviously is to have pilot data for future grant applications. The second mechanism is the grant planning awards, and these again are funded primarily for people who are already established, but not necessarily. And this work has to be focused on grant planning activities that will lead to a larger research proposal. So for both of these types of awards, I'll talk about the submission materials. So first is the letter of intent, which is required. And you can see at the bottom that we limit it to 1 page with half-inch margins in 11-point Arial font. And I'd like to emphasize that these letters of intent must be submitted through the portal on the USDeN website by 11:59 Pacific time on Monday, December 12th, 2022. And the links here provide more information for you. A look at which portions of the application apply to both pilot and grant planning awards. Here you can see that for both, the sections include study aims, significance, innovation, the approach, future directions, including what future grants to apply to, and then how stakeholders will be engaged in the study. And collectively, these sections can be a maximum of 5 pages, including a cover page, again with half-inch margins, 11-point Arial font, and these are due 11:59 Pacific time on Friday, January 27th, 2023. Excuse me. So just a little bit more about the grant planning awards. You know, the idea is for these to talk about how your activities will lead to a larger grant, including the aims and approaches for that larger scale study and what types of funding mechanisms you plan to apply to. So at this point, I'd like to introduce Dr. Nicole Brandt. She's one of the leaders of the USD Prescribing Research Network's Stakeholder Engagement Core, and she's going to discuss the specific requirements for stakeholder engagement in both the pilot and grant planning award applications.
Fantastic. Thank you, Dr. Mixon. And I also just want to do a thank you to Carmen Reyes, who's with me today, who's also part of our leadership on the Stakeholder Engagement Council and Core. Dr. Catherine Sarkeesian is my co-investigator and lead with the stakeholder engagement. And what we're really excited about is bringing the stakeholders' voice. If you've had a moment to look at our website, I strongly encourage you to look at our council members. And we have a very diverse stakeholder council. And we encourage stakeholder engagement and involvement with your proposal that you're hopefully going to be putting in. So next slide. So what do we mean by stakeholder engagement? So stakeholder engagement is participation from at least one stakeholder, either in an advisory capacity, such as maybe a council or advisory board, or as a full member of the research team. And this is required. So it's really important to think about the stakeholders you want involved in your project. And as you heard from some of the project proposals to date, some have involved patients, older adults, providers themselves, but it's important that we include patients, caregivers, frontline clinical providers, health system administrators and leaders, or others depending on the focus of your project. So I can speak eloquently to one of the most recently proposed and funded grants is by Dr. Hong, who's looking at beneficiaries' involvement with deprescribing and medication therapy management. And so with her proposal, she's engaged a diverse type of stakeholder as well, in terms of older adults, but different demographic and ethnic background too. So I think it's important to think about what you're trying to look at and being all inclusive in terms of stakeholders. When you're putting this together, it's important that you include a detailed description of your stakeholder. And if you have someone potentially that you can name in your proposal, that even gives us an understanding of your involvement with them, but realize that you might be establishing that. You're going to want to explain how they relate to the study topic in terms of their organizational affiliation, if it's applicable. Maybe you're putting together a tool and you want feedback from a national organization. And include background and relevant experience, motivation for participating, and projected activities that these stakeholders, again, are going to be involved with. So next slide. So how do you describe and incorporate meaningful engagement? Well, with one or more stakeholders or stakeholder groups that informs some aspect of your research process, including the topic selection, the study design, the type of research you're doing, and or the final dissemination of results. And I think it's important to think about how your stakeholders will be involved in the dissemination aspect as well. And detail needs to be provided on the selected stakeholders and again, the goals of their engagement and how they intersect with the work that you're doing, both in terms of your study aims and objectives. Also detail how stakeholders will or were recruited and how they were selected for the work that you're doing. We also look at your budget to ensure that there's a budget compensation that outlines how stakeholders will be compensated for their time and efforts. And again, equity is really important when we think about stakeholders' engagement. We also need to be mindful of a timeline of stakeholders and the expected study-related activities, along with the information about planned compensation for their involvement. So depending if they're involved in a council, maybe that meets once a couple times a year, or if they're actively involved on a regular basis. So you want to make sure that you specify them in your budget plan and justification pages as well. Next slide. So potential pitfalls that we've seen through the years, both in the pilot grant and as well as grant planning, is misidentifying all scientific clinical research team partners as stakeholders. That is your research personnel. Those are not your stakeholders. And there's the other thing we've seen, especially earlier on with the submissions, is a lack of appropriate or no compensation. We're not going to talk about money on this call, but there are resources out there, in particular, some put out by PCORI that can talk a little bit more about compensation. Other potential pitfalls are a lack of clear expectations on how the stakeholders are connected to the project, their specific role, their type and level of direct involvement, and ultimately, and how their feedback helps with decision-making with the project that you're doing. And we also want to make sure that, if appropriate to the work that you're doing, that there's varied stakeholder representation, and that's been a potential pitfall that we've seen in the past as well. So to aid you in this process, next slide, Amanda, is we've put together some videos from our stakeholder team and some of our stakeholder council members to guide you in terms of engaging stakeholders in research. And hopeful, if you have any questions, feel free to let us know in the Q&A or at another time. But again, we want to make sure that there's a strong stakeholder presence involved in your projects that you're submitting. Thank you, Dr. Mixon.
Thanks, Dr. Brandt. That was terrific. So I'm going to go over some other required supplemental materials for the applications. These do not count towards the 5-page limit that I mentioned before, but in particular, we need to have a half-page project description that's written for a lay audience that we can share with our stakeholders. There needs to be an NIH-style bio sketch with the most up-to-date format. And then there's several budget forms. One is a budget summary, a budget justification, which describes each person's involvement, a scope of work, and then an F&A rate agreement. For junior investigators, particularly for the pilot awards, we also need a 1-page mentoring plan and a mentor's letter of support included. So as I mentioned before, all these materials are to be submitted online at the USDeN website, noted here at the top of the slide. And just to remind you again of the key dates for submissions, the letters of intent, which I'm sorry, that says optional, they are required, that's an error, are Monday, December 12th by midnight, and then the full applications are due Friday, January 27th of the new year. We hope to have awards announced by May of next year, and then the funding typically begins around August or September of 2023. So now I'll talk a little bit about the scoring criteria by which these are reviewed. So each proposal is reviewed by 2 experts in deep prescribing, and they score your application on overall impact, innovation, the scientific rigor, feasibility, and the investigators and environment. Again, this is very similar to any NIH review criteria that you've seen in the past. And additionally, a few more criteria. One is that what is the likelihood that this work will lead to potential large-scale studies, the relevance to aging, the relevance to our priority areas that I mentioned, as well as the budget. And these last 2 areas, the priority areas and the budget, are not given scores, but are definitely considered by the reviewer. So once we have our awardees, there are some expectations and resources that are available to them. In particular, we ask that all awardees submit a year-end report that's structured, and it goes over what they've accomplished as well as what they plan to do. They are invited to then present their work at their network's annual meeting, and I'll talk about that in a minute. And then we also ask for awardees to answer a yearly survey about how they're doing as far as publications and grant proposal submissions. Some additional things available to the awardees. You will have quarterly calls with Dr. Simmons and I of the Pilot Corps. We also provide calls with the stakeholder engagement core, particularly at the beginning of your project. And we invite awardees to sign up on the USDN website to receive the newsletter and attend the webinars like the works in progress, as well as the scheduled webinars that are about monthly. The network also has an optional consultation service that you can access. Consults are for a very specific question that you would like to discuss with an expert that can be answered in approximately 1 hour conversation. And in addition to helping the awardees, these activities also help foster community across the network. So I wanted to also mention another program within USDeN that is sponsored by the Investigator Development Corps called the Junior Investigator Intensive Program. And they're seeking applicants for the 2023 cohort. The program components include monthly webinars by leading investigators in deeper scribing. There are virtual work in progress meetings with both domestic and international peers. Then there are career developments during the annual meeting and throughout the year provided to the junior investigators, as well as access to all the resources that I previously mentioned. The request for applications will be released soon, and the due date will be in February of 2023. And if you need more information, please visit the website. I also wanted to mention a previous webinar that we did last week, which was about a new request for applications regarding deprescribing of benzodiazepines and similar types of medications using complementary and integrative health approaches. This request for applications is due slightly sooner than this regular pilot and grant planning awards. We do have a webinar that you can watch that's posted on the website, and the link is provided there for more information. As I mentioned, there's an annual meeting of the network. The last one was in person on May 11th of 2022 in Florida, prior to the American Geriatric Society meeting. We had over 100 people attend, both in person and virtually, and we had several of featured speakers of experts in deprescribing. These recordings of the sessions can also be accessed at the website. And we're looking forward to the fourth annual meeting, which will be May 3rd in Long Beach, California, prior again to the AGS meeting. And just lastly, there is another grant opportunity that's provided by the network. These are called collaboration grants, and they often are to incubate on a topic or site-specific collaborative effort around deprescribing. In general, they're small grants from $500 to $5,000. And it might fund something like a mini summit for investigators in a geographic area, or seed money for geographically diverse investigators to collaborate on a topic. These applications include just a brief proposal and a budget justification, and you can submit them again on the website on a rolling basis, and they're reviewed as such, so apply whenever you can. And with that, I'll wrap up by saying, please visit the deprescribingresearch.org website, which is the network's website. And in the upper right-hand corner, the Join the Network button is a way to get the monthly newsletter, as well as hear about other things happening across the network. And with that, I will stop sharing, and we can open it up for questions.
So there's been a few questions posted. One question is actually related to the collaboration grants that you were just mentioning, and whether they have to include a researcher at an academic institution. And Mike, I don't know if you want to take that. My response would be a tentative no, that they could include anyone potentially, right? Especially like a stakeholder, a relevant stakeholder organization.
Yeah, absolutely. I mean, the goal of the collaboration grants is to foster collaborations that will lead to future research. And the research includes very much sort of the broad definition of partnered research and community engaged research that Nikki and others have been talking about. So yeah, absolutely. I mean, just keep in mind that the goal of that is to facilitate future research opportunities. So, but as long as it meets that overall goal, would love to hear what you're interested in.
Then there's a couple of longer questions in the Q&A, and we might need to follow up with people individually. But one person commented that the scope of the grant funding mechanism seems to be quite broad. And they're asking about, they're saying they have a specific interest in addressing faith-based communities of color and wanted to gauge how specific or broad they would need to be in addressing deprescribing using patient education and empowerment related to that, that particular target population. So I would initially say that we're definitely interested in attitudes and willingness to deprescribe across a diverse group of patient populations, and definitely if you have a way to involve or otherwise target minority populations in collecting survey data related to their preferences, willingness, or attitudes towards deprescribing, or tools that could potentially be utilized in communities of color to help them to feel more empowered to have these conversations with their providers, that all of those topics would be relevant. I don't know if, Mike, you want to add anything else?
Yeah, I think you said it really well. I mean, as long as it's related to, reducing the use of inappropriate or unnecessary medications or things that are related to that topic, it sounds fabulous.
And then there's another comment about, in family medicine, we have a grant to teach advanced care planning with an age-friendly component in an ambulatory clinic population related to identifying older adults at risk for falling and related deprescribing. We have a deprescribing tool that we use in case-based training program for residents. So they're asking about, I guess, sharing this with other postdoctoral training programs. I'm a little bit unclear about the specific question here. They're interested in writing up a proposal to assess and disseminate this tool to other postdoctoral training sites. That one's a little less clear to me.
I think the main comment I would make about that is that it does need to be a research study. So it's not just about sharing an educational intervention, but somehow then assessing its impact on patients or learners or something like that to qualify as a pilot.
Yes.
And what would be the next step after that, I think, is important to address as well.
Right. And there's another question, are full proposals only for those invited after submitting an LOI? So there's no invitation. We're requiring an LOI just so we know how many proposals we can expect. But if you submit an LOI, then you can automatically plan to submit a full application. There's no invitation that's based on the content of the LOI. Is it wise for non-US researchers to include researchers from the US or other countries? Certainly it could be advantageous to have collaborations outside your country, but you can also just clearly state within your proposal the relevance of your project to other countries, including the US. I don't know if, Mike, you want to add anything in addition to that.
Yeah, I think that said it well. I mean, so right, the studies we fund have to be relevant to some degree to care in the U.S., just given that we're funded by the U.S. NIH. But those studies can be done entirely in other countries, as long as those lessons, have generalizability in a broad context. So, whether it's strategic to include U.S. investigators in your proposal, honestly, I would just go with what's going to be most helpful for the science and the impact of your work. adding U.S. investigator advances that, great. But I wouldn't add a U.S. investigator just for the sake of having someone who's got a foot on American soil. I don't think that's going to make much of a big difference.
There's another question about the required component of mentorship. This is really just specific to junior level investigators. So if you're an early career junior level investigator, then we would recommend you having a more senior member on your team to provide some mentorship. And yes, that mentorship can be directly related to research methods or data analysis kinds of mentorship.
Although if I'm reading the question correctly, just to add to what Sandra was saying, I would note that that funding for career development activities can't be part of the budget.
Right.
So yeah, so the budget needs to be focused on advancing the actual science, although we, and there's other career development activities, we welcome to happen, but need to be funded through another mechanism. But we are very strongly encouraging of more junior people who are in sort of career development activities to apply for these awards.
Yes. Another question, as a nursing faculty member, would you consider a grant that addresses education for nurses about their role in reducing the use of unnecessary medications? So I think to Amanda's earlier point that education alone wouldn't be sufficient, that there would need to be there would still need to be a research component to that. Another question, could the use of pharmacogenomics and medication management be an interventional tool for deprescribing within faith-based communities, or would that just be too much as an intervention? We probably need a little bit more information about that, but I would say that if you're welcome to email us separately, or you can go ahead and submit an LOI with your proposed idea. And then if you need, follow-up or guidance at that point, we'd be happy to discuss it more with you.
Yeah, I think just one comment about that is just remember that these projects need to be done in a year's time. And so you don't want to bite off too big of a project. You want something that is feasible to accomplish in that time frame.
I believe that is all the questions that we've had. Unless
there are a couple in the chat.
Oh, okay.
Me to read them.
Let's see. Should the project be designed only for the geriatric population? It doesn't have to be solely for older adults, but it definitely needs to include older adults. But it can span a broader age range, as long as it's includes older adults and is still relevant to older adults. Do you have suggestions for hard metrics to use if you want to measure the capability of the intervention to reduce utilization? I'm not sure I entirely understand that question, but Mike, are there things posted on the website from our measures work group that would be useful to people who are applying?
Yes. So thank you, Sandra. So we have a measures work group that addressed a related issue about what are some of the kind of the key measurement things to think about when you're designing deprescribing studies. And that was published in the Journal of the American Geriatric Society. I am unfortunately blanking offhand if it's actually, it should be linked for our website, but I can't remember exactly where. Jonathan or Raha.
We'll make sure that it is now if it
Do you have
hasn't
anything
been already.
is there a link you can point us to? I'm sorry, I just don't remember offhand. But in general, I think the idea is that, just as with any sort of scientific study, it's good to have an outcome measure that is clinically meaningful and valid. And so as long as you can make the case that your outcome measure is clinically meaningful and valid, that's going to enhance the strength of your application. But but take a look at that paper because we'll have some specific guidance. But we'll also recognizing that the spectrum of potential outcomes is so broad, there's certainly a lot of different things to choose from, including things which are and are not listed in that paper.
There are also a few questions in the answer pile of the Q&A, and I'll, so can researchers from Canada answer the grant? Absolutely. We've had a couple people actually receive awards who are in Canada. Can non-research US researchers join the network? Absolutely. We would love to have you join the network. So just press that red button on the website. For the pilot grant, is $60,000 limit inclusive of indirect costs? Yes, it's direct and indirect costs totaling $60,000. And then finally, are postdoctoral research fellows eligible for the grant? The RFA said they had to hold a faculty member. So we, yes, by the time the award is granted, so in spring of next year, they do need to have a faculty appointment at an academic institution.
Or I would maybe just clarify that you need to have the promise of an academic employer. So in other words, if you're like in the last year of your postdoc and you're going to be starting a faculty job, say in July or August of next year, that's fine as long as you're able to say that. And if you can say in the application, I'm still negotiating with that university, I'm pretty sure I'm going to get it, but it's not signed and sealed yet, then that's fine. We would just confirm with you by the time that we're actually, doing the actual grant review and making our funding decisions. We would circle back to you and say, hey, just let us know, how's that going? Do you have actually a letter you can send us to confirm that you're actually going to be a faculty? But by next, say, August or September.
Now, the alternative would be to involve a faculty member and allow that faculty member to be PI, correct? And then the postdoctoral fellow, if there was a lot of uncertainty about whether or not they would have a faculty appointment at that time, they could just list themselves as a postdoctoral fellow on the grant or a co-investigator on the grant. Is that accurate?
Yes, thank you. Thank you, Sandra, for mentioning that.
Assuming
yes.
that they would still be at that institution for another year.
Exactly. So the idea is that, exactly. So if you're a postdoc and you're going to still be a postdoc, as of next summer, that you can be a co-PI on the grant along with the faculty member you're working with, because that faculty member then serves as like the designated faculty role.
Are there any other questions? I think we've answered everything that's in the chat and in the Q&A. But of course, if you think of something later on, you're always welcome to contact the network and they will funnel the questions to us and we can get back to you. From the LOI stage, the letter of intent, sometimes we do reach out to those applicants and just give feedback about the LOIs as well.
And just some of the questions, I just wanted to remind people of something that Amanda said earlier, but I think it just bears repeating, that one of the principal goals of this mechanism is to stimulate research that's going to lead to the next the next thing. So the project is not just about the project itself, although that's obviously important, but where it's going to take you. It will, this small grant will help you apply for a larger grant, or this small grant will catalyze your research career that will allow you to grow and thrive in this area. And that sort of forward orientation is an important part of what we're looking for in the review process. So make sure that you are articulating that in your application, but also just kind of keep that in mind when you're thinking about what you're doing, that we are less interested in something where you just do a project, it ends, we got some interesting results, and then it kind of stops there. That's going to be less of interest to our group.
Well, if there are no other questions at this time, I want to thank everybody for attending. And Jonathan did drop in the chat the email that you can contact us by if you have further questions. Anything else? Dr. Simmons, Dr. Brandt, Dr. Steinman, Ms. Reyes?
It was Lydia put a great job. It was very clear, so thank you.
And this recording will be available on the website as well, if you need to go back and refer to it. Okay, thanks everybody. Have a good afternoon.